that we have learned about all the ways of getting drugs into the body through those routes of administration, now we move on to pharmacokinetics in chapter 7, which is looking at how the body distributes and absorbs those drugs, and then ultimately how it gets rid of them. So our learning objectives are just understanding what pharmacokinetics is. We're going to be talking about the 4 parts, and then sometimes there's a 5th part called liberation. We'll talk about what that is. We'll talk about different releases of medicine from that form, either immediate or modified. And then we'll talk about transport into cells through passive diffusion, facilitated active transport, and also penocytosis. And then a couple other terms that go along here with is bioavailability and half-life. We'll learn what those are, as well as what's called the first pass effect that happens with oral medications, and then some of the factors that impact what this pharmacokinetics is. So first of all, pharmacokinetics is how the drugs get processed by the body. So it's not what the drug is doing to the body. That's the next chapter, pharmacodynamics. Pharmacokinetics is what the body is doing to it, how it's distributing it, how it's processing, breaking it down, and ultimately getting rid of it. So the movement is actually traced from the introduction of the drug until its elimination. So all of that is pharmacokinetics. And so it's the time that's needed for processing is important for knowing what dose to give. So again, how long does it take for it to get through the body? Do we need a big dose? Do we need a small dose? All of that is based on the pharmacokinetics. With pharmacokinetics and what the body's doing to this drug, there are 4 parts. So the first part is absorption. So how is the drug actually getting into the body? Then once it's in the body, we have distribution, how it gets through out the body into all the cells. Metabolism or biotransformation, those are used interchangeably. So metabolism or biotransformation, same thing. And then ultimately excretion. And so kind of an acronym that goes along with this, if we replace biotransformation with metabolism, is ADME. So A for absorption, D for distribution, M for metabolism, and E for excretion. So ADME helps you remember the order of those. Now, sometimes a drug also has to be liberated. So that liberation is the freeing of a drug from the administration form. So obviously, if something is given by IV, it is already free. It's coursing through the blood immediately. So it doesn't have to be liberated. So that's why liberation isn't always included with the steps. So some drugs need to be liberated, which means now there are 5. We have liberation and then absorption, distribution, metabolism, elimination. So the freeing of the drug. So usually this is whenever we're talking about an integral route. So if we take like a capsule, we need to break down that kind of waxy outer coating to actually release the drug that's inside, or like a gel cap or something, or even dissolving a tablet. So that is liberation. It's actually freeing the drug from how we're taking it. Now, once it's getting released, there are a couple different ways. It can be immediate, which as the name implies, that's form is easily broken down. So again, like the capsule, it's easy to, or like a gel tab, that outer coating is easy to break down. So it's going to release that immediately, and then it's going to be absorbed very quickly. But we also have a modified release, and this is designed to delay liberation, so modified or delayed release. So now we're actually administering the drug, but all of it isn't going to be released or absorbed all at one time. Instead, it's going to maintain kind of a peak effect, so that we have a reduced frequency of administration. So like a medicine that we take, and it only has to be given daily. So once daily, because again, it can kind of be a delayed or a slow release. Another example of this are like patches. So like a nicotine patch, or there are birth controls that are in a patch, or like the implants that are implanted. Those are, it's it's administered at one time, but it's not releasing all of that medicine at once. It's slowly releasing that medicine to kind of maintain a constant dosage as it's being absorbed. It's not all being absorbed at one time. So that's what we call modified release. So when liberation occurs, again, now we're going to add the L. So now we have L-ADME or LADME. But again, only whenever that has to be liberated. Not all medicines require that step. Again, IVs, for example. All right, so a little bit more about the modified release. So the modified has a delayed release. So this is going to be liberated sometime after administration. So instead of it being immediately released, it's still going to release it all at one time, but not right away. So it's going to wait for a given amount of time and then it releases that drug. Whereas extended release, that's going to be liberated over an extended time. So like I said, the birth control, for example, an implant in the arm, or even some of like the Depo-Provera shot that's given once every 3 months. That's an extended release. It's liberating it slowly over an extended amount of time. Delayed release just means it's drug's going to be taken, but it may not liberate. It may take it a while to break it down, so it's not actually releasing the medicine for an hour or for a while after actually being taken. So the extended release also has what we call sustained, which is going to be steady release over time, or it can be a controlled release, which is released at a specific time. So again, just all of those, though sustained or controlled, we're just releasing those over a longer period of time. Delayed, it's released all at once, just not right away. So again, our little acronym here, so ADME. So again, we have absorption. This is where the drug is actually taken into the circulatory system, so that circulatory system's involved here. The distribution, again, we're using that circulatory system to distribute or deliver the drug. Then we have metabolism, and this is where we're changing the drug as it's being broken down, or metabolized just means that we're breaking down. Another term, catabolism, there is breaking that original form down into something else. And then ultimately excretion, which is elimination or removing the drug from the body. So a little bit more about the absorption. So the drug is actually being taken into the circulatory system. So drugs like an IV drug, it doesn't really have an absorption phase because it's absorbed immediately directly into the circulatory system. All other routes of administration require this absorption. They have to get absorbed into the circulatory system. So this may or may not take place at the site of administration. So again, if we're taking a tablet, we're not absorbing it really in the mouth. It's going to be absorbed more down in the GI tract. So it's not always the same place. And it involves the transport. So we're going to talk about some of the ways of transporting things across cells or in and out of cells. So the drug has to move. So we need to move those drug molecules from an area of high concentration to one of low. Because again, if we have a drug we've just released into the gut, that has to be absorbed from a high concentration to a low. So what does that transport look like? So we have a few different ways of getting drugs in. Passive diffusion, so if something's passive, it's kind of, lazy, not really doing a whole lot, it's just kind of hanging out. So this is movement from a high to low concentration. If you think about spraying perfume or spraying something, you don't have to blow those particles. They just naturally move throughout a room until they're equally distributed. That's passive diffusion, moving from high to low, but we don't need any kind of input of energy to make that happen. So no energy is expended. Then facilitated diffusion is still diffusion. So we're still going from a high to low concentration, but now we need proteins to help develop some kind of pathway. So this is a drug or a molecule that can't just pass in and out of the cells. So like gases, like nitric oxide, for example, that helps, like with nitroglycerin, that helps prevent a heart attack. That's passive. That gas can just move right across the membrane from high to low concentration. A lot of drugs, though, need help. They can't cross the membrane of our cells, so they need a protein to help them. So that's called facilitated diffusion. Then we have active transport. Now, we're talking about energy now, and the energy is needed because we're going from a low to high concentration. And normally we use what's called ATP, or adenosine triphosphate. So we need energy to make it happen because we're going from low to high concentrations. And then pinocytosis, this is where instead of using like transport across a cell, the cell is essentially kind of engulfing. So it's forming these small little pieces of membrane called vesicles that bring in everything around that cell membrane. So here are just some pictures to kind of visualize what's happening. Again, passive transport or diffusion. We have a lot of molecule here on the left. It can easily cross through our phospholipid bilayer, that membrane of our cell, and it's going to go right into that lower concentration. Now, facilitated is very similar here. Again, diffusion, we don't need energy. It's going from a high to low concentration, so we have a lot on the outside, not so much on the inside, but the molecule cannot move across this membrane like we see with passive. So it needs the help of this transport protein, or this protein, to provide some type of tunnel or passageway for the molecule. So that's facilitated. It needs help. Then active transport, again, now we need energy to be expended, and this is because we're going from a low concentration to a high concentration. So it's like moving water up a stream. We need energy to do that. And then finally, pinocytosis. This is where the membrane of the cell actually forms this little vesicle. It pinches, kind of invaginates here. And what it's doing is it's just randomly taking whatever happens to be in the solution around it. It's going to bring that into the cell in what is called a vesicle, which is just a piece of the membrane that got pinched off, and whatever came in with it just came in with it. All right, a couple terms here that go along with pharmacokinetics is bioavailability. This is the amount of drug that actually gets into the circulatory system. So for an IV drug, it's 100% bioavailable because all of the drug is entering into the bloodstream. So it's 100%. That's why the dosing is much smaller for IV medications than like an oral medication if it was the same drug but given by that different route. Because again, IV is going directly, it's all getting in there. But if it has to go through the stomach, we're going to break some of that down. It's not all going to make it. So there's a smaller percentage, though. Again, not all of it gets into the circulatory system, so that determines the dosing as well. So whenever comparing it, the same drug, that has to be, that bioavailability gets compared, because even if we have the same drug but it's manufactured a little bit differently, that can change the bioavailability. And sometimes that's why physicians or surgeons will want like a name brand drug versus like a generic. Sometimes the bioavailability isn't quite the same even though it's the same drug. So sometimes that leads to determining which drug or which form of the drug will be used. All right, so now that we have all of the drug or whatever amount of the drug into the circulatory system, now we're ready to actually deliver it to the target cells, which is distribution, and that's using that circulatory system, so those arteries and veins, to help us get everything where it needs to go. So this is also going to be delivered to the entire body because, again, once something gets in the bloodstream, it's going everywhere. It's not directed. And sometimes this is what causes those undesirable results. So we may be targeting something in the brain, but because it's going all throughout the body, it might impact the GI system or joints, or it could, alter the liver or other parts of the body because it is going all throughout the body. Now, metabolism or bio transformation, this is the breaking down of the drug, and those are referred to as metabolites. So as a drug is broken down into smaller chemicals, those smaller chemicals are called metabolites. And this predominantly occurs in the liver. So if we think about the circulatory system being important and the absorption and distribution, now the liver is where we're mainly breaking down. It's kind of our detox center. It's breaking things down. So this can also occur in a few other places like the blood plasma, the mucus of the intestines, the lungs and the kidneys, but for the most part, we think about the liver. Now, a term that goes along with metabolism is half-life. So if we kind of break that word down, it's just the time that it takes to reduce the drug concentration. So how much of the drug is available by 50%. So now it's already in the bloodstream. So let's say 100 grams was absorbed into the blood. How long does it take for 50% or 50 grams of that drug to be removed or broken down by the liver? That's referred to as the half-life. And that's going to determine the frequency. So how often do we need to give the medication depends on how quickly it's being broken down. If it takes a long time to break it down, we don't have to take it as often. Here with metabolism is what's called the hepatic portal system. And this is really only a factor with oral medications. So what's going to happen is whenever oral medication comes in the GI system, so in the gut, so we have our small intestine, we also have the large intestine here. So this hepatic, meaning liver, portal, talking about circulatory system, this actually sends blood from the abdominal organs to the liver. So before an oral medication ever really makes it into the circulatory system, it's going to go to the liver first. So it's coming through the stomach where it's going to get broken down by acid, gets into the small intestine where it starts to be absorbed through all that transport that's happening into the circulatory system. So that's the absorption part. But then before it gets distributed to the rest of the body, it immediately hits the liver where it's going to be metabolized. So this is really important for determining the dosage with oral medications, is because, again, unlike an IV where bioavailability is like 100%, with oral, it's much less because not all of it's going to get absorbed through the small intestine into the circulatory system. But then even whatever does get in, some of that's going to get broken down immediately in the liver before it ever makes it into the main circulatory system. So that is why the dosing for an oral medication is so much higher than if it would be given in IV form. So again, with those oral medications, we worry about this hepatic portal system because, again, it gets metabolized right after it gets into the circulatory system before it ever gets to like the brain or any other part of the body. That process is called the first pass effect. So that hepatic portal system is that portion, again, that first gets sent to the liver and it's going to be biotransformed or metabolized before it ever gets to the general circulation. So that first pass, it's first going through the hepatic system, through the liver. It's going to get metabolized before it ever gets to the main circulatory system. So again, the patient doesn't receive the full dose. The bioavailability is going to be much, much less because of that metabolism so soon after being absorbed from the gut. So again, that dosage has to be calculated to compensate how much that bioavailability is reduced. All right, and then our last part here of pharmacokinetics is excretion, or that elimination of the drug from the body. So we have the circulatory with absorption and distribution, we have the liver mainly with metabolism, with excretion. This is mainly going to be occurring with our kidneys. So that biotransformation, that metabolism is needed, especially to change fat-soluble medications into water-soluble compounds. So if it's fat-soluble, it gets stored in the body longer, so then it takes it longer to metabolize and longer to eliminate it because, again, our kidneys are the main thing because we're excreting most of it through the urine. Fat-soluble compounds aren't going to dissolve into the urine to get eliminated. So that excretion and that metabolism helps convert those fat-soluble to water-soluble compounds. So the small number gets excreted by exhalation. That's why, like, if the breathalyzers work, if somebody's looking for a DUI, because some of that alcohol is metabolized or excreted through the air, the passage. So that exhalation is one way of excreting, some through the feces, some saliva and sweat, but again, mainly drugs are released through the urine. So urine tests are looking for a lot of different medications. Some of them are also excreted into breast milk, so that's why it's important for moms who are breastfeeding to understand if they are taking medication. It's important for them to know whether that can be passed through the breast milk and to the infant. Clearance is another term that we have. So we have bioavailability, we have half-life. Clearance is another term here, and that's the removal of the drug from a specified volume of plasma. So how much gets removed per per liter or milliliter of that plasma. All right, so finally, just some different factors that can affect all of this: the metabolism, the absorption, all of that. So this is a long laundry list of things that can affect it, and most of it is kind of common sense. So the drug form, so is it a gas? Is it a liquid? That kind of thing. Is it a solid? That can impact how much gets absorbed by the body. The route of administration, again, IV, 100% of bioavailability. Oral, probably one of the least bioavailability. The dose, so how much is given, determines how much gets absorbed and all of that. The interaction with other drugs, so if multiple drugs are given, are they kind of sticking together? Are they decreasing the absorption? The NPO status, this is whether or not the stomach is full. NPO referring to the stomach fullness. So if you've heard before, so it's better if you are drinking alcohol to drink on a full stomach, not on an empty stomach, because depending on your goal there, but again, if you have a full stomach, less of the alcohol gets absorbed. If you are drinking on an empty stomach, you're likely to feel the impacts or the effects of alcohol much faster because there's less in your stomach to inhibit the absorption into the blood. The patient's age, so as we age, the liver, the kidneys, all of that starts slowing down. Comorbid conditions, so this is whenever multiple things are happening. So if somebody has congestive heart failure or diabetes plus another condition that we're treating, that other condition can impact their liver or kidneys, and then that can impact their pharmacokinetics. Circadian differences, this is one that probably doesn't really think about, but this is your sleep patterns that can impact how the drug gets processed. Plasma binding proteins or plasma protein binding. So these are proteins inside of the blood that can actually bind to different drugs, which makes them not available to be going to a target. So that can impact it. Again, tissue binding. So things can attach to different tissues, especially fat-soluble drugs. They can attach to those fat cells and they kind of get hung up there. Pregnancy can impact, again, elimination and metabolism. Different barriers like our blood-brain barrier, so things may not pass into the brain because it can't get through that blood-brain barrier or through the placenta if it is trying to reach into the fetus. And then just the physical properties of the drug, so the characteristics of the drug itself. And then lastly, just the availability of transporters. So for that absorption into the cells, that passive diffusion or facilitated. So if it's facilitated diffusion and it needs a transport protein, if that transporter is not there, it doesn't matter how much you give, none of it's going to get into the circulatory system. So it'd be 0% bioavailability. So all of these things impact how the drug gets processed into the body.